Assalamu alaikum and welcome into first Super 6 match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. After long and exciting journey of 18 group matches, we have stepped into arena of Super 6, where 6 teams will compete with each other and 2 teams will qualify for grand finale, which is going to be held in PHL meeting next month. Today's Super 6 match is between 𝐏𝐚𝐤𝐻 Invincibles and Lum Striker. Today we are blessed with the kind presence of Professor 𝐏𝐚𝐤𝐬𝐿 Sahab. He is Professor of Medicine and he would be serving as an umpire of today's match. Patron-in-Chief of Cardiometabolic Premier League is Professor Mohammad Ishaq Sahab. He is Professor of Cardiology at KHD Karachi. For moderation purpose, we have with us Dr. 𝐏𝐚𝐤𝐬𝐿 Khan Sahab. He is Assistant Professor of Cardiac Electrophysiology at RIC Rawalpindi. For further moderation, over to Dr. 𝐏𝐚𝐤𝐬𝐿 Khan Sahab.
Thank you very much, Usman Saab. Assalamu alaikum everyone, and welcome to this, the first Super 6 match of the Cardiometabolic Premier League, in association with the Pakistan Hypertension League, the Pakistan Society of Internal Medicine, and powered by Wilson's Pharmaceuticals. There were 36, and now there are just 6. 18 very exciting matches, a lot of very close calls. We needed our umpires to step in, including Professor Azizur Rahman, who's with us today. And now we are down to just 3 matches that will determine the final 2. And they will fight each other in the final at the PHL event in Lahore. So who do we have today? We have 2 wonderful teams. We've seen them both perform wonderfully well in the previous round. The first is 𝐏𝐚𝐤𝐻 Invincibles. 𝐏𝐚𝐤𝐻 is Abbasi Institute of Medical Sciences from Muzaffarabad. And also from Hyderabad, we have the 𝐿IAقat University of Medical and Health Sciences Strikers. So it's the Invincibles versus the Strikers. Very catchy names. And they are going to be fighting it out today. And remember, winning isn't enough. You have to win very, very well in order to qualify for the final. The top 2 teams out of the 6 will qualify for the final in Lahore. And I wish everybody the best of luck. But everybody's a winner here in the Cardiometabolic Premier League. So let's get cracking. Let's introduce the teams. First, let's see who we've got first. Okay, so it's the 𝐏𝐚𝐤𝐻 Invincibles. Welcome.
Thank you so much. I'm Dr. Zainab Shahab, and together with me on my right side there is Dr. Hassan Waheed, and on my left side Dr. Tahira Rafiq, and on my extreme left there is Dr. Sarim Farooq.
You guys gave an exceptional performance last time. I believe you scored 10 out of 10. So hopefully you can do equally well this time round. Are you looking forward to it?
Inshallah. Yes, sir.
Okay, excellent. Great. Wish you the best of luck, 𝐏𝐚𝐤𝐻. Let's go
Thank
to
you.
Hyderabad, 𝐿IAقat University. How are you guys doing? Are you nervous? Introduce yourselves, please.
Assalamu alaikum. My name is Dr. Gulzar Fatma, and I have with me Dr. Poonam, Dr. Hira, and Dr. Momin. And we are nervous, obviously, but we are confident as well. Hopefully, we'll win this, inshallah.
Wish you the best of luck. You performed brilliantly last time. You were a real credit to your institution. And I wish you the best of luck this time. But
Thank
for
you.
both teams, I would like to say that we've been watching this tournament very interestedly over the last few months. I believe we started in November, and Professor Azizur Rahman is here. Sir, it's great to have you on board. You've been with us since the very beginning. What do you make of the quality and the standard of the teams in the preliminary rounds? And do you have any advice for these 2 excellent teams for this competition?
I think both definitely performed very well in their previous matches. That is why they are here. So I would like to wish them, both of them, best of luck. And with this message that it is actually the learning process which is a main reason to have this tournament. But of course, winning is additional bonus. So I think I wish both the team best of luck.
Thank you very much for your kind message of support, sir. And I'm sure if needed, you will spring into action as always and help us out. Thank you very much, sir.
Thank you.
So let's move on. Let's remind ourselves of the rules of the game. So there is an initial coin toss. and we will nominate 𝐴𝐚's Invincibles for the coin toss. They will decide whether it's heads or tails. And the winner of the electronic coin toss will choose the case, and they will choose whether they're batting or bowling, or whether they are asking questions or answering questions. So 𝐴𝐚's Invincibles, you have the honor of the coin toss, the first coin toss in the Super 6 matches. You are going to nominate either heads or tails. So what do you choose?
We are going with heads.
So you've chosen heads. Let's roll that coin. It's tails. It's tails. No problem. Let's move on to Liaquat University of Medical and Health Sciences. You guys have won the toss by default. They picked heads and tails fell. Do you want to ask questions first or answer questions first?
Sir, we would like to ask question.
You'd like to ask questions first. Okay,
Yeah.
let's go to the cases. What would you like to pick? Case A or case B?
Case B, I guess. Yeah.
You've chosen case B, so you're going to ask the questions of case B. Is that right?
Yeah.
Okay, that's fine. So you're going to ask questions of case B from the 𝐴𝐚's Invincibles. Great. So you remember the format. You are going to read out the case history clearly, and then you are going to read out the questions, and the opposition have 60 seconds to answer. A reminder for 𝐴𝐚's Invincibles and yourselves that you need to keep the microphones on at all times. We need to be able to see your reasoning. Professor Azizur Rahman is our umpire, and he's going to be monitoring closely what people are saying, and I'm sure that he'll give the benefit of the doubt when it's due. So wish you the best of luck, and I wish 𝐴𝐚's Invincibles the best of luck. Let's have a look at case B. Read it out, please. Liaquat University. Strikers.
I cannot see the question.
So strikers, can you see the question? Strikers, can you see the question?
Yeah. No, I cannot see it.
Okay. If the technical team can fix the issue. In the meantime, I shall read out the question. 𝐴𝐚's Invincibles, can you see the case scenario?
Yes.
Okay, I shall read it out until the strikers get their screen sorted out. I shall read it out. So it's case B. A 64-year-old woman with a 12-year history of hypertension and obesity with a body mass index of 31 has dyslipidemia and diet-controlled diabetes. She presents with a blood pressure of 156 by 92 millimeters of mercury, despite taking amlodipine 10 milligrams, losartan 100 milligrams, and chlorthalidone 25 milligrams daily. She frequently uses ibuprofen for knee pain. Home blood pressure readings confirm elevations. In terms of her labs, her eGFR is 68 milliliters per minute per 1.73 meters squared. Her potassium is 4.0 milliequivalents per liter. Her ECG shows LV hypertrophy. She asks about intensive targets and additional management options. Strikers, do you have the screen now? Can we have the strikers on, please? Strikers, can you see the screen now?
Yes, we can see the screen now.
Okay, can you please read out question 1 when the question comes on?
Okay. All right.
Question 1, read it out. Question 1 on screen, please.
What is the first diagnostic step recommended when evaluating persistent hypertension in a patient already on 3 antihypertensive drugs? Option A is initiate renal.
हमारी स्क्रीन चली जाती है मतलब अब ये आ रहे हैं तो हमें हमारा क्वेश्चन नहीं नजर आ रहा
Can we fix
Please
this
read
issue?
please read it as a resistant hypertension.
इसको जूम करें
Please read this persistent hypertension as resistant hypertension.
Okay. So it's resistant hypertension.
Okay.
Resistant hypertension in a patient already 3. Initiate renal denervation, perform home blood pressure monitoring, perform renal artery imaging in all patients, combine ACE inhibitor with ARB and start minoxidil empirically. रेजिस्टेंट हाइपरटेंशन में वैसे हाँ रीनल आर्टरी इनर्वेशन पे ही जाना चाहिए क्योंकि ब्लड प्रेशर मॉनिटरिंग तो नहीं होगी.
Okay, start the clock, please. They're obviously seeing something.
Okay.
So, can we have AIMS Invincibles on the screen?
रेजिस्टेंट हाइपरटेंशन को मॉनिटर करना है 3 एंटी हाइपरटेनिक्स पे है. तो होम ब्लड प्रेशर मॉनिटरिंग हम नहीं करते, तो रीनल आर्टरी इमेजिंग इन ऑल पेशेंट्स भी नहीं करते, मतलब सारे पेशेंट्स में हम लोग नहीं करेंगे. तो कंबाइन एनएसी इनहिबिटर विद एन एआर भी वो भी नहीं करते, स्टार्ट में नॉक्सिडिल भी एम्पेरिकली नहीं करते. तो फिर ऑप्शन ए ही ठीक नहीं है, इनिशिएट राइनल डिनर्वेशन है. रेजिस्टेंट हाइपरटेंशन में हम डिनर्वेशन नहीं करते. डायग्नोस्टिक स्टेप ऑफ रीनल डायग्नोस्टिक स्टेप. अच्छा डायग्नोस्टिक स्टेप, फर्स्ट डायग्नोस्टिक स्टेप रिकमेंडेबल. ठीक है, हाँ इसको देखने के लिए लो सार्टन देख रहा है. ठीक है. ऑप्शन सी चार्ली.
Okay, you've gone for option C. Is that the opinion of all of you? You've got 8 seconds. Okay, let's lock that in. Option C. Is that the correct answer or is it something else? Oh no, that was a very tough one. A very tough one. You were on the crease. You faced the fast bowler and the first delivery was an in-swinging Yorker. An in-swinging Yorker that absolutely destroyed your off stump. You faced it as well as you could, but that was very unlucky. That was a very tough question, I have to say. As someone who works in this field, it was a very tough question. But unfortunately, we weren't able to score that.
This label somebody as a truly resistant hypertensive, we have to make sure that this is not white coat phenomenon, and we have to monitor either home readings or the ambulatory readings.
Sir, thank you so much for that clarification. It was a very tough question, but that makes absolute logical sense. And that's what we do. So let's move on to question 2. Can you read out the question, please? Strikers, read out the question.
Sir, which common factor in this patient is most likely contributing to resistant hypertension? Option A is low potassium intake. Option B is sleep deprivation. Option C is NSAID use. Option D is hypercalcemia. And option E is beta blocker therapy.
Okay, start the clock. So, in this patient, what's contributing to resistant hypertension?
NSAID use कर रही है जब तो फिर हाँ NSAID use करिए, आइबुप्रोफेन ले रही है, NSAID के साथ भी आपकी होती है, आपकी हाइपरटेंशन इंक्रीज हो जाती है. लेकिन उन्होंने पूछा है कॉमन फैक्टर इन विच पेशेंट मोस्ट लाइकली कंट्रीब्यूटिंग टू रेजिस्टेंट हाइपरटेंशन. तो कंट्रीब्यूशन में तो NSAID यूज है. हाँ NSAID यूज आपको वो करेगा. CKD पे 68 भी है. पोटेशियम ठीक था, पोटेशियम 4 है, स्लीप डिप्राइवेशन करते हैं, हो सकता है,
Half your time's gone.
NSAID यूज पे.
The clock is winding down.
हाइपरकैल्सीमिया नहीं है. कैल्शियम कितना था नहीं बताया हुआ, लेकिन हाइपरकैल्सीमिया प्रेडिस्पोज नहीं करेगा ना उसको मेरे ब्लॉक थेरेपी भी नहीं करेगा. ऑप्शन चार्ली.
So you've gone for option C. Captain, option C. Is that your final option? Okay. Are they right?
Yes, we are going for option C.
Lock it in. Can they do it? Can they do it? Yes, they're off the mark. They are off the mark. The fast bowler tried to test them again with a short ball, but they have hooked it and they have absolutely smashed it out of the park. Brilliant, brilliant play. That's a sixer. Sixer to get off the mark on the second ball. Well done, AIMS Invincibles. You're off and running. Let's see how you can do now. Let's move on to question 3, please. Read it out, strikers.
In ESC hypertension guidelines for high-risk patient, what systolic blood pressure threshold
is used to initiate pharmacological therapy? Like diabetes more than or equal to 130.
Okay, can strikers read it out, please? And AIMS Invincibles just listen.
Yes.
Sir, the screen is not present here. We cannot see the question clearly on the screen.
Okay, let me read it out. In ESC hypertension guidelines for high-risk patients, what systolic blood pressure threshold is used to initiate pharmacologic therapy? A, greater than or equal to 140 millimeters of mercury. B, greater than or equal to 150 millimeters of mercury. C, greater than or equal to 160 millimeters of mercury. D, greater than or equal to 130. Or E, greater than or equal to 125 millimeters of mercury. Start the clock. AIMS Invincibles, it's your call.
तो डायबिटिक पेशेंट हाई रिस्क पेशेंट्स में टारगेट हम 130 रहते हैं। अगर नॉन डिसलिपिडीमिया पे तो रिस्क फैक्टर्स में आपका मोर देन और इक्वल टू 130 होता है जिस पे ट्रीट करते हैं, और अगर नॉन डायबिटिक पेशेंट हो रिस्क फैक्टर्स ना हो फिर हम 140 पे भी जाते हैं अकॉर्डिंग टू योर। तो हाँ, लेकिन फिर भी आपका टारगेट कंट्रोल पे भी मोर और इक्वल टू 130 ही होता है। तो वी आर गोइंग विद ऑप्शन डेल्टा। Option
Okay,
delta.
half your time's gone. Now, our umpires and our patron in chief, Ishaq Sahab, always says, take your time. So we've got time. Think about it. Are you sure it's delta? Are you sure?
Yes. Yes,
Okay.
we are sure.
Okay, if you say so, Dr. Saab, let's lock it in. Delta D, greater than or equal to 130. Are they right? Yes. Yes, yes. They face the medium pacer. They're square facing it up, and they've smashed the ball down the ground straight over the bowler's head above the side screen, and it's gone for another 6. Great shot. So it's another 6. Score is 12 after 3. So we're getting into a good score territory. The potential to build a good score is coming up. Let's see how else they do. Question 4, please. Read it out.
Which clinical trial demonstrated that spironolactone is the most effective add-on therapy in resistant hypertension? Options are there. A, ALHAT, B, pathway 2, C, sprint, D, HYVT, E, advance.
Start the clock, please. So we're talking trials. 5 trials are mentioned here. Which one demonstrated spironolactone as the effective add-on therapy in resistant hypertension?
spironolactone और RIN2 मुझे लगता है कि sprint है C होगा। एग्जैक्टली तो ट्रायल याद नहीं है, लेकिन मुझे लगता है कि C sprint है। नहीं, मेरे हाथ से
30 seconds.
sprint ही करते हैं। अब एग्जैक्टली याद नहीं है कि कौन सी ट्रायल है।
12 seconds left. We need an answer. 10.
Charlie.
C for sprint. Are they right? I think they've guessed. Are they right though?
Yes.
Are they right? No, they were wrong. They guessed, they gambled, but they lost. They haven't lost everything, but they've lost this particular ball. They tried to attack the leg spinner, and the delivery went right through the gate, and it's whipped off their bails. They are out in this delivery. So the score is 0-6-6-0, a score of 12 out of a possible 24. They're still in the hunt. They still have the potential to build a very competitive score. These questions are difficult because this is Super 6, so we don't expect people to get all of them right, but it's a good effort so far. Question number 5, please. Read it out.
Which mean 24-hour ambulatory blood pressure threshold correspond to an office reading of 140 by 90 millimeter of mercury. A, 125 by 75, B, 130 by 80, C is 135 by 85, D is 140 by 90, and E is 140 by 70.
E is 120 by 70. Start the clock.
35%. 135 by 85.
So a knowledge of ABPM is required to answer this question. Common investigation used to rule out white coat hypertension.
No, कोई और लग रहा है किसी?
मैं ये कह रही हूँ कि discussion करने
30 seconds left. The clock is winding down. We're going to need an answer in the next 25 seconds.
ठीक है। We are going with option Charlie.
Option Charlie. Is that the opinion of all of you?
Yes.
Okay, let's lock it in. C, are they right? No, not again. So the opposition have got the bit between their teeth and they're bowling fast balls, and this one has been edged to first slip and is out. So AIMS Invincibles, they've had their name put to the test. So far, 2 correct out of 5, so a score of 12. but they're still in the hunt. These are very tough questions, and I'm sure the other questions for the other team are going to be equally tough. So stay focused, stay grounded, and stay in this match, please. Let's move on. Question 6. Read it out, please.
According to the SPRINT trial, how much lower are automated office blood pressure readings with patients resting alone and multiple readings averaged compared with manual office measurements by HCP?
HCP is
5 by
healthcare
3.
provider. Keep going.
A is by 5/3, B option is 10 by 5, C is 15 by 7, D is 20 by 10, and E is 25 by 12.
Okay, so the question is the difference in office blood pressure readings and manual readings by the healthcare provider. So what's the difference? So the clock is ticking down. We're talking about differences in blood pressure. 30 seconds left. 30 seconds left. 𝐴𝐚𝐤𝐬's Invincibles. You've got half the time left. 15 seconds left, guys. Come on.
10 by 5 we can press. ठीक है. We are going with option beta.
Beta, is that the opinion of all of you? 5 seconds left.
Yes, sir.
Okay, B, lock it in, lock it in. Yes, 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 yes. Some confidence. They're facing the medium pacer again, and this time they've charged down the pitch and they have smashed it on the offside for another 6 over the boundary. Well done. So that's 18 on the board. We're getting there. We're going to build a competitive score, hopefully. Well done, 𝐴𝐚𝐤's Invincibles. Let's move on to question 7.
What is the defining feature of a hypertensive emergency? A, any BP more than 180 by 120. B is the need for the intravenous medication. C, a new headache with elevated BP. D is failure of 3 oral agents to bring BP to less than 184 by 90. And E is severe BP elevation with acute end organ injury.
So the D is a misprint. It's 180 by 90, not 184. 180.
कब हो जाएगा ना न्यू हेडेक विद एलिवेटेड बीपी वो अगर कंफ्यूजन और उसके साथ हो सकता है इमरजेंसी हो सकती है तो नीड फॉर आईवी मेडिकेशंस भी वो भी नहीं है कोई क्राइटेरिया में उसमें और बीपी मोर देन 180 120 भी नहीं है तो फिर ऑप्शन ई ही है बीपी एलिवेशंस वेयर है मोर देन 220 120 और फिर उसके बाद मोर देन 200 220 पे 120 होती है और फिर एंड ऑर्गन डैमेज पे होता है तो ऑप्शन ई ठीक है वी आर गोइंग विद ऑप्शन ई
E for epsilon, is that right? E for elephant?
Yes.
E for elephant. Okay, so are they right? They've gone through the options. They've chosen E. Lock it in, please. Yes. Yes, again, another score there. They have swept the spinner and it's gone high in the air and it's gone into the leg side over the boundary and it's been caught by one of the spectators. So that's another score there. So a score of 24. So they're building the momentum. Well done, 𝐴𝐚𝐤's Invincibles. Let's move on to question 8.
What mechanism best explains pseudo-tolerance to the vasodilators in the resistant hypertension? A, RAS suppression. B, hyperkalemia. C, increased diuresis. D is salt and water retention blunting effect. E is bradycardia.
Start the clock. So pseudo-tolerance to vasodilators in resistant hypertension. What's going on?
Renin acid increased diuresis. Pseudo-tolerance to vasodilators with vasodilators. पूछेंगे vasodilators का रिस्पॉन्स हम कहते हैं कि टॉलरेंस कुछ भी है
Half your time is gone. 𝐴𝐚𝐤's Invincibles.
Water retention bleeding effect होगा मेरे ख्याल से
15 seconds left.
रेडिकार्डिया नहीं कराते इसमें।
10 seconds.
डेल्टा ही
8 seconds. We need an answer. We need an answer now.
डेल्टा
Delta, salt and water
Delta.
retention blunting effect. Let's lock it in. We've got no time to argue. Yes, they've done it again. They've done it again. The bowler has strayed down the leg side and they've tickled it behind the keeper, but it's gone in the air and it's gone over the boundary for 6. Well done. So that's a hat-trick of 6s. They're building the momentum slowly. They've got a score of 30. They're almost competitive. So let's move on to the next question. Question number 9.
Which I cannot see the screen.
I will read it out. Which home blood pressure monitoring protocol is recommended to ensure diagnostic accuracy? Is it A, measure once weekly at any time of day? B, take 3 readings at night only for 2 days? C, measure only after vigorous exercise? D, record BP when symptoms such as headache occur? Or E, record 2 readings morning and evening for 7 days, discard the first day and average the rest?
ठीक है डायग्नोस्टिक ऐसे नहीं था नहीं डिस्कशन देख मयूर वंस वीकली है ना ठीक है हाँ नहीं बनता टेक 3 रीडिंग्स एट नाइट है और मयूर ओनली आफ्टर विगोरियस एक्सरसाइज रिकॉर्ड बीपी ओनली व्हेन सिम्पटम्स तो रिकॉर्ड 2 रीडिंग्स we are going with option E.
Option E. Are you sure? You've got time
Yes.
to discuss and debate? E for
Yes, we are
elephant.
sure.
Okay, they're sure. Let's lock it in. Yes. The bowling tried to bowl Yorker again, but it was actually a full toss and they smashed it down the ground and it's gone for another 6. So they really have built the momentum in the last 4 questions. They've got a decent score of 36 and they have the potential to build it up further. Well done, AIMS Invincibles. So let's move on to the last question, question 10. Let's see how they do.
In a patient with preserved renal function, ejection glomerular filtration rate is 68 milliliter per minute, and resistant hypertension, which diuretic strategy is the most appropriate? A, stop all diuretics. B, use only loop diuretics. C, avoid diuretics with RAS blockers. D, continue chlorothalidine. And E is use salt substitute only.
Start the clock.
प्रिजर्व रीनल फंक्शन में तो डायरेटिक्स स्टॉप नहीं करते मतलब अगर इंडिकेटेड है तो लूप डायरेटिक्स हम देते हैं जब ज़्यादा डाउन हो जाए नहीं मतलब प्रिजर्व का पूछा हुआ नहीं प्रिजर्व रीनल फंक्शंस का पूछा हुआ हाँ थायराइड को अभी हम दे सकते हैं थायराइड दे सकते हैं अवॉइड डायरेटिक्स विद रास ब्लॉकर्स ये मतलब नहीं है और यूज सॉल्ट सब्स्टिट्यूट्स ओनली तो सब्स्टिट्यूट्स वो भी नहीं है मतलब मेरे ख्याल से डेल्टा बनता है क्लोरथैलिडोन का क्योंकि हम लोग क्लोरथैलिडोन कंटिन्यू कर सकते हैं अभी हाँ 30 से EGFR जो तो फिर नहीं करते अभी हम कंटिन्यू कर सकते हैं क्लोरथैलिडोन को डायरेटिक हम अगर 30 से 40 से नीचे ही चला जाए फिर हम लोग डायरेटिक यूज़ करते हैं इससे पहले हम लोग प्रिजर्व रीनल फंक्शन का पूछा तो अभी हम कंटिन्यू कर सकते हैं क्लोरथैलिडोन को क्लोरथैलिडोन को पता क्योंकि थायराइड डायरेटिक्स है ना तो हम लोग
10 seconds, guys. 10 seconds.
ऑप्शन डेल्टा
Option Delta, let's lock it in. Can they do it? Can they do it? Yes, they've done it again. 5 in a row. That's fantastic performance. So they have scored a final score of 42. So they faced the final delivery. It was high above their head, bouncer, and they've hooked it. They've taken a chance and it has gone over the boundary again for another 6. So they have a score of 42 out of a potential 60. I think that's an extremely competitive score. I think they've done very, very well there. AIMS Invincibles have done extremely well to get a score of 42. So that part of the contest is over, and now we will move on to Hyderabad Liaquat University of Medical and Health Sciences strikers. They will have their turn. Can we have Professor Azizur Rahman on the screen, please?
I just want to ask the defender team, the Invincible team, did they find any question difficult or unreasonable or invalid or ambiguous?
सर वो जो क्वेश्चन नंबर 1 था उसमें ऑलरेडी मेंशन था कि उन्होंने होम बीपी मॉनिटरिंग की है और उसमें उनकी वैल्यूज़ हैं एलिवेटेड वैल्यूज़ हैं हम उसके बारे में पूछना चाह रहे हैं कि अगर ऑलरेडी होम ब्लड प्रेशर मॉनिटरिंग की वैल्यूज़ हाई हैं तो फिर हम उसको दोबारा कैसे करेंगे
No, but let me get to the question.
Sir, question number 1 है.
जी मैं जा रहा हूँ.
लिखा हुआ नहीं है, आपकी कोच की भी है, बस ठीक है.
So that was the scenario. Assalamu alaikum, Professor Ishaq
The
Sahab.
question is clear.
Assalamualaikum. Sorry to join late. I'll be joining intermittently because I'm.
Okay, I think this question does not necessarily refer to this particular patient. It is an open-ended question that what is the first diagnosis step recommended when evaluating persistent hypertension or resistant hypertension already on 3 antihypertensive drugs? This is an open-ended question, not specifically related to this case scenario. So I think before we label somebody as resistant, we have to make sure this is not white coat hypertension, and we have to have either home blood pressure readings or ambulatory blood pressure reading. I think the question is valid.
ये तो हमें सिनेरियो दे चुके हैं ना. सिनेरियो देने के बाद तो फिर हमें डायरेक्टली नहीं पूछ सकते कि आप इस तरह से करें कि अलग से क्वेश्चन आ गया है. सिनेरियो वाइज ही होना चाहिए क्वेश्चन.
Sorry, I missed the question. I think the scenario.
सर यहाँ पर कंफर्म हुई हुई है ना, होम बीपी रीडिंग्स आर एलिवेटेड.
सर जो सिनेरियो है उसमें बीपी रीडिंग्स उन्होंने कंफर्म की हुई हैं, फिर उसी से रिलेटेड क्वेश्चन नहीं आता कि आपने उसी के बेस पे सिनेरियो बेस्ड क्वेश्चन का आंसर करना है. तो उन्होंने तो कंफर्म किया है, और इंटेंसिव टारगेट्स और मैनेजमेंट, और फिर क्वेश्चन में भी फर्स्ट में उन्होंने ये लिखा हुआ था कि वो डेली इन्वेस्टिगेशन आप क्या करवाना चाहते हैं, मतलब इस तरह का नेक्स्ट स्टेप डायग्नोस्टिक स्टेप पूछा हुआ था.
Yes, but then in the scenario, this reading is high, but in the question, I'm not asking that is this patient already we can label it as a resistant hypertension or we have to do something further. The question says, okay, before we label anybody as a case of resistant hypertension, what should we do? And the answer is clearly out of the options. Answer is that we have to monitor home readings or ambulatory readings because there could be white coat hypertension.
The umpire has spoken. Thank you very much, Professor Aziz-ur-Rahman. The rules of the competition are such that when the umpire gives his ruling, we have to accept it. So I think that was reasonable of AIMS Invincibles to query it. But Professor Aziz-ur-Rahman, thank you very much, sir, for clarifying the answer. So the score, sir, your opinion, and then we'll ask Professor Ishaq Sahab. What do you think of the performance of AIMS Invincibles? Do you think that they performed well?
That's fine. Sorry, Ishaq, please go ahead.
Sir,
नहीं मैं तो सर माफ चाहता हूँ, मैं join late किया है, तो I missed the earlier part, so I may not be in a position to make any comment.
I think they were very confident. Their discussion was very, very reasonable. But unfortunately, they dropped few questions. But I think overall performance was very good.
Thank you very much for your kind input. Professor Ishaq Sahab, as always, sir, we've had comments from Professor Aziz-ur-Rahman. Thank you, sir. And can we have Professor Ishaq Sahab on the screen?
Yes, I'm here.
Sir, it's an honor, as always, to have you on board. These two teams performed excellently in the previous round. And I personally think that the AIMS Invincibles did extremely well to even get 42. I think they were very difficult questions. But I'm glad that you're joining us, sir, for the remainder of for the contest today. Thank you very much for joining us, sir.
You're welcome.
Thank you, sir.
My pleasure.
So let's move on. So we've done one half of the contest. Let's try and see how the strikers perform. Let's have the other case on the screen, please. Case A. Can we have AIMS Invincibles read out this case?
A 58-year-old man with central obesity, waist circumference is 110 centimeters.
Sir, we cannot see the scenario.
Can we have the scenario on for the strikers, please?
Obesity.
So I believe that we've sent you a screenshot. Is that correct, strikers? Do you have a screenshot of this case?
Yes, sir, we have got it.
Okay, you've received it. AIMS Invincibles, read it out, please.
A 58-year-old man with central obesity, waist circumference is 110 centimeter, BMI of 33 kg per meter square, type 2 diabetes from 8 years, albuminuric, CKD, EGFR 42 ml per minute, and NYHA class 2 heart failure, presents for optimization of cardiometabolic risk. Current medications: metformin, bedtime glargine, insulin, amlodipine, hydrochlorothiazide, and atorvastatin 40 mg. Clinic PP is 146 by 84 millimeter of mercury. HbA1c is 8.1. He previously developed genital itching after starting a new diabetes medication, now discontinued. LDL is 96 milligram per deciliter. Triglycerides is 220 milligram per deciliter, and HDL is 36 milligram per deciliter.
Okay, so strikers, did you follow that case?
Yes, sir.
Okay, excellent. So you've absorbed the case. Now it's time for the questions. 𝐴𝐚𝐤𝐬𝐿 Invincibles, ready to read out question 1. Question 1 on screen, please.
Which sodium glucose transporter 2 inhibitor trial demonstrated that treatment reduced
Sir, we cannot
hospitalization
see
for
the
heart failure?
questions.
Wait a minute.
We can't.
Can they
We
see the
can't see the-
questions?
No, we can't see the question.
Okay, technical team, we need to ensure that... Do you have a screenshot on your phone? Yes or no?
Yes, sir. We have the screenshot now.
Okay, 𝐴𝐚𝐤𝐬𝐿 Invincibles, read it out, please.
Which sodium glucose co-transporter 2 inhibitor trial demonstrated that treatment reduced hospitalization for heart failure regardless of diabetes status? Option A, leader. Option B is emperor reduced. C is B and E. D is canvas, and E is DAPA HF.
B and E. Sir, we would like to go with the C.
Option C. Are you sure?
Yes, sir.
Okay, let's lock
I
that in.
suggest they should take their time. They should not jump on the conclusion so quickly.
I agree totally, sir. Professor Ishaq has chimed in with his advice. Are you sure, guys? Are you sure? Have you discussed it
Sir,
carefully?
We have doubt on B and E, and if there is option of B and E, we would like to go with the C.
Okay, that's fine. That makes sense to me. If you're all agreed on it, we will lock that in. Lock in option C, please. Yes, you are absolutely sure. You went with your gut, and that's a brilliant start. The first delivery you faced, good length ball, but you've charged down the pitch, and you've smashed it on the leg side for a sixer. So, excellent start for the strikers. They were confident, and they were sure, and they've delivered. Well done. Question number 2, let's read it out. And can we make sure that they have it on their screenshot as well? Okay, so you have it on the screenshot. 𝐴𝐚𝐤𝐬𝐿, read it out, please.
Which clinical trial showed that dual renin-angiotensin system blockade with an AC inhibitor and an ARB increased the risk of acute kidney injury and hyperkalemia without improving renal outcomes? Sprint. Option A is Sprint. Option B, On Target. Option C is Advance. Option D is Hope. Option E is Accord.
Start the clock, please. Let's have the strikers on screen. Microphones on, please.
You are confident? E. Okay, E. We would like to go with the E.
That's a very, very rapid and very, very quick response. How sure are you? Are you absolutely sure?
Yes, sir, we are sure. We are kind of sure because we actually don't know the answer. We have to go with the one and then we want to go with the E.
So you've guessed, but you've decided to guess quickly.
Yeah.
Okay, I suppose that's reasonable. They've guessed and they've said, okay, let's make up our minds quickly. They have guessed for E, Accord. Are they right? Are they right? Let's lock it in. Oh no, they guessed. They seemed confident. They seemed confident. They charged down the pitch to the spinner, looking to whack him on the offside, but they missed, and they have been stumped out by the keeper, miles off their crease. So they were. The trial was on target. Unfortunately, the strikers were off target this time round. But good effort. Well done. It's fine. You're still in the game. You are still in the game. You need to beat a score of 42. So don't lose heart. Keep going. Question number 3. Can we make sure that the strikers have question number 3 on the screen? And read it out, AIMS Invincibles.
In a patient with type 2 diabetes, stage 3B chronic kidney disease, and atherosclerotic cardiovascular disease, what is the most appropriate blood pressure target according to current guidelines? Option A is less than 140 by 90. Option B is less than 135 by 85. Option C is less than 130 by 80. Option D is less than 125 by 75. And option E is 120.
Clock starts now. Let's have the strikers on screen, please.
Less.
So a lot of blood pressure values there.
तो अभी तो क्या करना चाहिए हमें?
Half your time's gone.
सी करें.
Let's have the strikers on. No talking from AIMS, please.
Sir, we would like to go with the D.
Okay. D for Delta. D for Delta. Are you sure? You've got 10 seconds to change your
Sir,
mind.
the new guidelines have changed, so I don't know if it is updated or not. But I
Okay,
think
let's see. Stop the clock. Delta, D, less than 125.75. Are they right? No. That's unfortunate. That is really, really unfortunate. Guidelines, they do change. And they may have changed recently, but you were found wanting there. Very, very unlucky there. Very, very unlucky. Let's move on to the next question. Question number 4. Read it out, please. AIMS Invincibles.
According to DAPA-CKD trial, what is the lowest estimated glomerular filtration rate at which dapagliflozin has been shown to provide benefit? Option A is 45 ml per minute. Option B is 30 ml per minute. Option C is 25 ml per minute. Option D is 20 ml per minute. And option E is 15 ml per minute.
Start the clock. Very, very specific EGFRs here. It's a tough question.
तो 30 से ऊपर हमारे पास ऑप्शन तो कौन सा चूज करें? 30 से कम का 30 से ऊपर तो इस ए ऑप्शन है.
30 seconds gone. Think very carefully.
Sir, B. We would like to go with the B.
Are you absolutely sure? Are you certain?
We have to stop the drug.
So below 3 we have to stop it, so I would like to go with the 30. They are asking about the lowest limit, so we would like to go with the 30 because below
Okay.
that we have to stop.
Lowest limit according to the trial. Jello, let's see what happens. Stop the clock. Option B. Lock it in. No. I think they were asking about the trial. They were asking about the trial. That may have caused confusion. I'm really, I feel for you. Unfortunately, you faced Glenn McGrath at his peak, and he's bowled it just outside off stump, and you've nicked it to first slip, and there's nothing you can do. That's very, very unlucky there. Very tough question. Okay, let's move on to question 5. Read it out, please. AIMS.
Which adverse effect is most consistently associated with sodium glucose co-transporter 2 inhibitor therapy? Option A is hypoglycemia. Option B is lactic acidosis. Option C is pancreatitis. Option D is genital mycotic infections. And option E is hyperkalemia.
Start the clock.
Sir, D.
D for doctor. Is that right?
Yeah.
Okay. You seem extremely sure of yourselves. Have you discussed it? Have you agreed amongst yourselves? Okay, you're going for broke. You have to get this right. It's a must win. Must win. Let's lock it in. D. Can they do it? Can they do it? They've done it. They are still in this match. They're still fighting. They're still fighting for this match. Brilliant, brilliant performance. They haven't given up. They're not giving up. So that's another sixer out of the park. Well done, strikers. Let's move on to the next question swiftly. Question number 6.
Which class of glucose-lowering drugs is most strongly associated with weight loss and proven reduction in a major adverse cardiovascular events? Option A is sulfonylureas. Option B is thiazolidinediones. Option C is GLP-1 receptor agonist. Option D is DTP4 inhibitors. And option E is alpha-glucosidase inhibitors.
Okay, let's start the clock.
C. We would like to go with the C.
Within 3 seconds you've decided C. How sure are you? Is
We
this
are
another
sure.
Is this another guess?
No, we are sure.
It's not a guess. Okay, it's not a guess. Shukar hai. Okay, let's see whether they're right this time. Option C. Yes, they are right. They are right. They were challenged with the short ball outside off stump, and they have square cut it, and it has gone in the air over third man for another 6. So that's 2 in a row. They're building up momentum. They can still get a competitive total, and they can still even the scores. So they're in the hunt with this match. Let's move on to question 7, please.
In long-term studies of type 2 diabetes, control of which risk factor yields benefits comparable to intensive glycemic control? Option A is LDL cholesterol, option B is blood pressure, option C is triglycerides, option D is cigarette smoking, and option E is aspirin use.
So risk factor control. You've got 60 seconds. You've got 5 options: LDL, blood pressure, triglycerides, cigarette smoking, or aspirin use. Can we have strikers on the screen, please? Half your time has elapsed.
तो B, blood pressure, I guess. कौन सा बताओ, जल्दी बताओ. B? जल्दी बताओ. We have 10 seconds. B,
Come
B,
on,
sir.
guys. Come on. B.
B.
You've gone for B.
B,
Okay.
yeah.
B for blood pressure. Let's go for it. Have they done it? Yes, they've whipped this one. They've picked up the length early, and they've whipped it on the leg side, and it has gone in the air for another 6. Great shot. Well done. Well done. So they're still in this match. That's a hat trick of 6s. They're in this match still. They're still fighting, and they can still do it. Question 8, please.
Which pattern of fat distribution confers the highest cardiometabolic risk? Option A is visceral, option B is hip, option C thigh, option D gluteal, option E overall.
Start the clock. Let's talk about fat. Okay, within 3 seconds, once again, Liaquat University strikers have gone for their answer. Are you sure?
Yes, sir. We would like to go with the A. Yeah.
Okay, they're
Yes.
sure. They're not going to change their minds. I'm sure they're not going to change their minds. Option A, visceral. Lock it in. They've done it again. Charged down the pitch with confidence, and they have smashed the ball over the bowler's head, over the side screen. One of the spectators has caught it. It is a 6. 2 more questions left. You need 2 to tie with the AIIMS Invincibles. Let's go on to question 9. Read it
Which
out.
sodium glucose co-transporter 2 inhibitor was associated with an increased risk of lower limb amputation in a randomized control trial, although this finding was not consistently reproduced in later studies? Option A is empagliflozin, option B is canagliflozin, option C is dapagliflozin, option D is ertugliflozin, and option E is sotagliflozin.
Tough question there. Start the clock. 53 seconds left. Come on, let's have strikers on the screen. Let's see what they're saying.
ही के यूज होता है
30 seconds. So I think they're using a process of elimination. 15 seconds left.
Okay, sir, we would like to go with the B then.
B, is that a guess?
Yeah, it's a guess because we don't know.
Let's hope it's a good one. Lock it in. Option B, are they right? You bet they're right. Brilliant guess through a process of elimination. Brilliant, brilliant play once again by the strikers. They are fighting back and they are fighting hard, living up to their name of being strikers. So they have struck the ball very hard. They've clubbed it, absolutely clubbed it, and it is traveling at velocity and it is out of the stadium for a sixer. Well done, strikers. Well done. So last question.
Last question here.
Last question. Can we?
Which is going to decide?
It's going to decide. Yes, read it out.
Which lifestyle intervention has been associated with a reduction in systolic blood pressure of 8 by 14 millimeter of mercury, even without weight loss? Option A is DASH diet. Option B is Mediterranean diet. Option C is alcohol restriction. Option D is aerobic exercise. And option E is intermittent fasting.
Let's start the clock. So a lot of options there. They all seem reasonable. Strikers on the screen, please. So this will decide whether you get to a runoff or whether you draw. Can we have strikers back on, please? Reconnect, please. Reconnect. So we've had some technical difficulties. Our technical team is on the phone with the strikers while this is going on. But we will need an answer eventually. So do we have them? So we're trying to reconnect with the strikers. We've had some technical difficulties. We are trying to reconnect to the strikers. This is an absolutely critical moment, so we really need a reconnection soon. Strikers, we need strikers on. Audio or visual, one of the two. We'll need the answer somehow, either on the phone or in reality. We will need the answer. What's the answer? Professor Azizur Rahman, we would like to engage you at this time. Unfortunately, we've lost connection with the strikers.
They can be contacted on telephone.
We are trying to contact them right now. We seem to have trouble on the telephone as well. Unfortunately, this is a very wrong time for this to happen.
Very critical because we have to have the answer, definitely.
So,
if they have read the question, I think they can give the answer on the phone.
Yes, I totally agree. If we don't get an answer soon, we may need to ask for your opinion regarding giving them another question in the interests of fairness. I still haven't heard from the technical team. We're still waiting, technical team, for an answer. They are back on screen. Let's give them an opportunity. They were supervised during the break. Can we have an answer, please?
Like to go.
We'll give you time. I think we.
B or A? exercise the alcohol restrict intermittent fasting. A. Mediterranean. नहीं डाइट तो है अब A या B में से बताओ सर we'd like to go with the A.
Okay, option A, a strange interlude where we lost you completely, but you've given your answer now as option A. We'll have to leave that to the umpires to see whether they accept it, but let's find out whether they're right or not. Option A, dash diet, are they right? They are right. So on the scoreboard, they have equalized. It's 42-42, Ames Invincibles and the Strikers. So in this situation, normally we would go for a runoff. As I understand it, it was absolutely very unfortunate that we lost you when we did. But if they were able to see the question during that time, so I don't know if the umpires will say anything about it, but we will proceed to a runoff. A runoff.
Sir, I would like to say that the question that we were talking about, the recent guidelines that have changed now, I would like the umpire to, sir, to take it into the consideration if the recent guidelines they can see and, the question with the BP, the 130 and the 125.
So there's an appeal there.
Question number 3. Question number 3.
Yes, sir. Question 3.
Let's have that question up.
Yes, sir. Question 3.
Yeah, it is reference the ADA 2023 and KDIGO 2022 guidelines. And the correct answer is C, less than 130 and less than 80.
I think this figure has been there for a while now, and it's not a new figure.
अच्छा उनका reference 2023 का था अच्छा okay
Yeah.
Okay, so
this is the correct answer.
Thank you very much.
This is the correct answer. I support Professor Azizur Rahman.
Thank you, Professor Ishaq, and thank you very much to Professor Azizur Rahman, our umpire. So the umpire's decision is final, and Professor Ishaq has backed up that answer. So that's the end of that issue. Now let's move on to a runoff. So who's going to go first? I think we'll have the same order as before. Let's have questions for Ames Invincibles first. A question for Ames Invincibles which will be asked by the Strikers. So Strikers, read out the question and Ames Invincible will answer. Just a reminder that this is sudden death. Ames will answer one question, and in response, Strikers will answer one question, and it is a sudden death scenario. So if one team gets it wrong and the other team gets it right, that will decide the winner. So it's all or nothing. This is the crunch. Both excellent teams, and now you get to fight over the final part of this competition. So let's read. Question, please. Strikers, read it out.
How should AC inhibitor or ARBs be viewed in adults of African descent with hypertension? Less effective without a diuretic but still indicated for the proteinuric CKD. B is completely, I cannot see the screen. Completely ineffective and should be avoided. C is always superior to diuretics for the stroke prevention. D is recommended only when combined with beta blockers, and E is mandatory first-line therapy in all cases.
Start the clock. 5 options. Ames Invincibles online, yes. Can they do it?
फर्स्ट में आपके कैल्शियम चैनल ब्लॉकर्स ही होते हैं, लेकिन अफ्रीकन डिसेंट में आप प्रोटीन यूरिया को इनहिबिट करने के लिए एआरसी इनहिबिटर्स आरबीएस दे सकते हैं अलोंग विद डायरेटिक. मतलब ये रिस्पांस है, ये है रिकमेंडेड. तो आई गेस ऑप्शन ए इज करेक्ट. कंप्लीटली इनफेक्टिव नहीं है, दे सकते हैं, मतलब सेकंड लाइन चॉइस है, फर्स्ट लाइन चॉइस नहीं है, और फर्स्ट लाइन चॉइस ऑप्शन ए ही है.
Half your time has elapsed.
बेस्ट पीरियड टू डायरेटिक्स ये भी नहीं है, रिकमेंडेड ओनली व्हेन कंबाइंड विद बीटा ब्लॉकर्स ये भी नहीं है, मैंडेटरी फर्स्ट लाइन थेरेपी है. ऑप्शन ए अल्फा.
A for alpha. Is that the opinion of all of you or just one of you?
Yes, all of us.
Okay, you've said it. Let's lock it in. Option A. Yes, they've done it. It's a devastating blow to the heart. But they've done it. You are in the lead. You are in the lead in this shootout. So you were involved in a bowl-off, and you have bowled and you have whipped off the bails with your spinning delivery. So you are in the lead. You can't lose yet. So let's move on to strikers. 𝐴𝐚𝐤𝐬's Invincibles, read out the question.
After failure of non-insulin glucose-lowering therapies to achieve HbA1c targets, insulin is typically initiated while metformin is continued. What is the rationale for continuing metformin? Option A, because it decreases the hepatic glucose production. Option B, because it decreases the renal glucose reabsorption. Option C, because it increases the insulin secretion. Option D, because it reduces the glucagon secretion. And option E, it delays the gastric emptying.
60 seconds.
वो भी करता है लेकिन main effect hepatic glucose production. Sir, we would like to go with the A.
Okay, option A. Let's lock it in. You seem quite sure. Let's lock it in. You've discussed it. Option A, are you right? Are you right? Yes, you have equalized. Yes. The scores are level. You are still in this match. You are still fighting. Well done, strikers. There's an advantage to going first. Always in any penalty shootout or bowl-off, there's always an advantage to going first, statistically, but let's see if that can be reversed in this competition. Strikers, read out the next question, please.
एक मिनट अब वो time based होना चाहिए, but they are not saying it so. What is the usual reduction in systolic blood pressure with sodium restriction to below 100? A is 0 to 2, B is 2 to 8, C is 10 to 15, D is more than 20, and E is no effect.
So that's millimeters of mercury. 𝐴𝐚𝐤𝐬's Invincibles. The ball is in your court. 𝐴𝐚𝐤𝐬's Invincibles.
Yes. Option B ही correct 10 to 15 नहीं होती, उसके साथ डाइट के साथ होती है, more than 20 आपकी एक्सरसाइज के साथ होती है, तो वो टू option beta.
Option B for beta. B for beta. Is that your final option?
Yes, final option.
All right, 2 to 8 millimeters of mercury. Are they right? Lock it in. And again, brilliant. Brilliant by 𝐴𝐚𝐤𝐬's Invincibles. You've certainly been invincible in the sudden death round. Well done, 𝐴𝐚𝐤𝐬's. Brilliant. So, 2-1 is the score. The pressure is on the strikers. Can they do it? Can they level up? Can they put the pressure back on 𝐴𝐚𝐤𝐬's Invincibles? Let's go on to that question. 𝐴𝐚𝐤𝐬's Invincibles, read out the question when it comes on the screen.
In patients of African descent with hypertension and albuminuria, which regime is most consistent with current guidelines? Option A is beta blocker monotherapy. Option B is ACE inhibitor alone. Option C is direct renin inhibitor. Option delta is CCBs, thiazide, and RAS blocker. Option E is hydralazine.
Strikers on the screen.
Calcium channel
हाँ देने AC देते नहीं है तो उसमें फिर हम herbs तो देते हैं herbs still is option हाँ D and then there's thiazide also ना C or D. So we would like to go with the D option.
Option D, is that your final choice?
AC inhibitor तो नहीं दे सकते यार उसमें फिर यही देंगे D क्योंकि आप कैल्शियम चैनल देते हो आप herbs दे सकते हो. अच्छा D.
Okay. So D for delta.
Yeah.
Fine, let's lock it in. How have you done? Yes. Yes. You're still fighting for this. Well done, excellent. So this is a real nail biter. This is really going down to the wire. It's like a penalty shootout in a World Cup final. So that really has turned up the screw on AIM's Invincibles now. So strikers, read out the next question.
Once blood pressure is controlled on a stable regime, what is the appropriate follow-up plan? A, monthly laboratory tests for all patients. B is visit every 3-6 months, which laboratory tests tailored to medications. C, stop all medication after 1 year of the control. D is require a yearly ECG for all patients. E is follow-up exclusively by telehealth.
AIM's Invincibles, it's yours. Do we have AIM's Invincibles? Yes. We can't hear them.
Follow up के exclusively telehealth. Once blood pressure is controlled on a stable regime पे है, stable regime है ना, फिर follow up करेंगे टेलीपैथी पे. Visible मुझे लगता है कि हम डायरेटिक्स वगैरह दे रहे होते हैं ना, sometimes हम 3 to 6 early हम उनके इलेक्ट्रोलाइट्स फॉलो करते हैं, तो मुझे भी बीटा ऑप्शन ओके हम उसको देखते रहें कि ब्लड किस में उसमें जा रही है. बीटा के साथ ही जाएंगे. ठीक है. ऑप्शन बीटा जो भी हमने.
Option B, beta. Is that the correct answer? Lock it in. Lock it in. Yes. Yes. So B for beta is the correct answer. They've done it. They've scored. And they are in the lead. And the pressure is now on. Lum strikers, the ball is in your court. Let's see how you do.
We have a screen issue. We cannot see the screen.
Okay, let's wait for that issue to resolve. Can you see it on your laptops?
Right now we can see, but the question, when question comes, it, again after a few seconds, it goes away. It disappears.
Okay.
In a patient with apparent resistant hypertension,
we cannot see the screen.
Wait.
We cannot see the question.
Let's wait.
Yeah.
Screenshot is available. Okay, let's go.
Sorry, हमारी screen भी blur है.
I will read out the question. Question 13. In a patient with apparent resistant hypertension, what is the most evidence-based next diagnostic step before intensifying therapy? A, add spironolactone. B, ambulatory or home blood pressure monitoring. C, double the dose of antihypertensive medication. D is increase amlodipine. E is switch hydrochlorothiazide to chlorthalidone.
इंटेंसिफाइंग थेरेपी मतलब थेरेपी को आप हाँ कंफर्म नहीं है और आपको पहले इंटेंसिफाई करने के लिए व्हाट वुड यू लाइक टू डू इन्वेस्टिगेशन व्हिच यू वांट टू डू. हाँ वही है ना, वही है. तो बी आई थिंक इज द राइट ऑप्शन.
So is it B?
B? It is B, yeah, sir.
Okay, B for beta. Let's lock that in.
Yes.
You've done it. So this is a really, really tight contest. An extremely tight contest. And I am unable...
Excuse me,
Yes.
sir.
Yes.
ये वाला जो क्वेश्चन था इनका ये रिपीट क्वेश्चन है, ये तो हमारे क्विज में भी था.
Dr.
right.
Qurban, can I have your permission to leave? I have to go to another meeting.
Sir, it's an honor. It's a real honor having you.
And it's a really very interesting match today. Both the teams are very strong, very resilient. And
Yes.
I don't know who's going to win at the end of the day, but thank you. And with the permission of Professor Azizur Rahman, I'll take your leave.
Thank you, sir. It's an honor having you. Best wishes. Professor Azizur Rahman Sahab?
I think this was just a chance that the question got repeated. I think it is still valid. It's just a luck.
Okay, but it wasn't repeated in the same, for the same team.
Yeah, it is the other team, but then...
It wasn't repeated, but it's kind of same, like the concept was same. The scenario was totally different.
Yeah. Well, I think the umpire has spoken, so that is it. That is the end of that. Let's move on to the next question. We're still in sudden death. Still in sudden death. So let's see what the question is now.
Which statement best defines the masked hypertension? A is office BP high Sir, I cannot read it properly.
Let me read it out. You have a laptop screen in front of you, but I will read it out just to make things easier. Which statement best defines masked hypertension? Is it A, office BP high, home BP normal? B, both office and home BP values high, but home readings are higher? Option C, office BP normal, home BP elevated? D, both office and home BP elevated? E, office BP variable, ambulatory BP normal?
ऑफिस बीपी इसमें नॉर्मल होता है, ठीक है, और होम एलिवेटेड होता है, तो इसी को मास्क कहते हैं, मतलब इसके ऑपोजिट होता है, तो आपका वाइट कोट आ जाता है ना. तो ऑप्शन चार्ली सी.
Okay, option C. Option C. Okay, let's lock that in. Option C, are they right? They've done it. Perfect. Absolutely perfect. 4 out of 4 in their sudden death. Let's move on to Lum Strikers. Ames Invincibles, read it out, please.
स्क्रीन पे नहीं आया, स्क्रीन पे नहीं आया. अच्छा. Which glucose lowering drug classes, when added after metformin in patients with established cardiovascular or renal disease, have demonstrated cardiovascular benefit? A is acarbose and pioglitazone. B is sulfonylurea and insulin. C is DTP4 inhibitors and repaglinide. D is GLP-1 and SGLT2 inhibitors. And E is colsevlam and bromocriptine.
D. It's D, sir.
D for Delta? Well, you're sure about it. I'm not going to challenge you. Have you done it
No,
right,
sir,
though?
we are sure.
You're sure?
Yeah, we are
Excellent.
sure.
Let's lock that in. Let's see how they've done. You've done it again. You have done it again. You have equalized. You have ensured that you're still in this competition. And I wonder, do we have any more questions?
Yes, we have one more question for each
We
team.
have one more question for each team. Let's see how they do. Strikers, read out this question for Ames Invincibles, please.
When should renal sympathetic denervation be considered for a patient with hypertension?
सर वो
A-
स्क्रीन बहुत छोटी आ रही है, एक मिनट अभी समझ नहीं आ रही है मैं. ऑप्शंस ठीक है.
Read
A
it out,
when
please.
BP is more than 200 by 130. B is when white coat hypertension is confirmed. C is when the patient prefers device therapy over medication. D in the setting of hypertensive emergencies. And E is after excluding secondary causes and existing conventional therapy.
ऑप्शन बी तो 230 नहीं है ना. वाइट कोट हाइपरटेंशन कंफर्म के लिए फिर भी हम थेरेपी देते हैं. पेशेंट प्रेफर्स डिवाइस थेरेपी और मेडिकेशन से भी नहीं है. ई ज़्यादा जा रहा है, और फिर एक्सक्लूडिंग सेकेंडरी कॉजेज हमने रूल आउट कर ली हैं, और एग्जॉस्टिंग कन्वेंशनल थेरेपी मतलब हमने थेरेपी दे दी है और रिस्पॉन्स नहीं आ रहा, और फिर उसके बाद अब क्या जाते हैं. ठीक है. ऑप्शन ई.
Option E for elephant. Okay, is that your
Yes.
final answer? Are you sure?
यस फाइनल
Okay,
आंसर.
you're sure that's it? Fine?
यस.
You're right. You are right. So that's 100% record, 100% record in the shootout. That's brilliant. That is absolutely brilliant by Ames Invincibles. You can't do better than that, certainly. Okay, let's move on to the strikers question. Ames Invincibles, please read it out.
When considering cardiometabolic outcomes in type 2 diabetes, which intervention provides broader benefit than intensive glycemic control? Option A is blood pressure reduction. Option B is LDL cholesterol reduction. Option C is triglyceride lowering. Option D is smoking cessation. And option E is aspirin use.
Sir, A.
Okay, you've gone for option A. Let's lock it in. Okay, that's correct. That is correct.
सर ये भी रिपीट क्वेश्चन है.
The question is
सर ये भी
different.
इसी टीप का रिपीट था.
The question is different. The question is different, but I understand the concept is very, very similar. We'll have to ask the umpire for his opinion on that.
I think we can have a meeting later to decide, but as of now, both teams, I think they're equal. The match ended in a draw.
So can we do the rules, sir, allow for the match to end in a draw?
I'm not sure, we don't have further questions.
Okay. I'll just confirm that
Sir?
with my technical team.
Sir, I would like to say that initially, when the competition was started, we were being told that when there will be the draw match, then the decider will be the timings. So that's why we were giving the fast
We'll do
answer.
that. We will sit later. We will finalize it. We'll study the video again and see which team responded faster and more.
Okay, sir.
सर हमें तो नहीं बताया गया था टाइम के बारे में कि टाइम कुछ है, क्योंकि हमें तो बताया गया था कि आपने 60 सेकंड्स में विद डिस्कशन करने हैं, तो टाइम का तो हमें नहीं पता था। और रिपीट क्वेश्चंस भी हैं विद सेम कॉन्सेप्ट्स, तो इस इशू को भी देखें।
But when there's try, there should be some rules. Obviously, the timings should matter there because we were fast. We were giving the answers more rapidly.
I've been told by my technical team that the timing issue is not going to come into the Super Sixes. It may have come earlier on, but not for this competition. So it is a draw. It is a draw. We will have a meeting. Unfortunately, we can't decide right now. One of you very, very good teams is going to make it through. We'll have to discuss it with the umpires and the other senior faculty involved. It sometimes can be a bit, hopefully not disheartening when we don't have a clear winner. But when the standard of competition is this high, it's very, very difficult to pick a winner between these two wonderful teams. I'm sure you'd agree, sir. Professor Azizur Rahman, I'm sure you'd agree that the standard was very high.
I think at this moment, we have to declare it as a draw and then we later decide what to do next. Maybe a repeat match, maybe whatever we will discuss amongst ourselves.
Thank you very much. I think that would be extremely fair. I think a repeat match would be fantastic between these two excellent teams on a different topic perhaps. That might be the best solution and the fairest solution given what's happened. So at this stage, I think let's call it a draw as said by the umpire, and the umpire's decision is final. I think both teams can be extremely proud of the way that they've performed today. I would like to have the feedback from the teams on their performance and how they think they've done today. 𝐴𝐚S Invincibles, how do you think you performed today?
I think we performed very well in this match.
I think you did brilliantly. I think you should be extremely proud of the way you've done. You fought right until the end. You didn't lose. This was a draw. Now it's up to the umpires. You did the absolute best that you could. You performed brilliantly in the sudden death. The questions were tougher in the initial 10 questions, but I think you should be extremely proud of yourself. I think the level of knowledge and the level of dedication you obviously have in your training is shining through. So I think you should be extremely proud of your performance. Well done. Well done.
Thank you so much. Thank you.
Strikers, how do you feel you did?
Sir, we think that we did our best, and we hope that the decision comes in our favor. So let's hope for the best.
I don't know what's going to be decided, whether it's going to be decided on this contest or whether there should be another contest. We shall have to see. It depends on the umpires.
Yeah.
And
Definitely.
whatever is decided, we will inform you of the decision. But
We trust their judgment. We trust their judgment. Obviously, they are the seniors, and they are gonna decide the best. So
yes,
yeah,
I think previous performance before even Super 6 may actually come into it. I've been informed by my technical team that they will consider how well you did it prior to the Super 6. That may play a role as well. But whatever it is, this is like a sport. It's a game. You are all winners. Our 𝐴𝐚S Invincibles are winners, and the strikers, you are also winners. We've all learned a lot. We've gained in knowledge. We're going to be better as a result of this. So I think there is no winning and losing. There's just winning in this competition. So I think both teams can be extremely proud of the way that they've performed. What a nail-biting contest. I have to say this is the best one I've ever seen. And with that, even though we haven't come to a final decision, there will be a decision eventually. I wish to say thank you to Wilson's Pharmaceuticals for supporting us. Thank you to the Pakistan Society of Internal Medicine and the Pakistan Hypertension League for your kind support. Thank you for our umpire, Professor Azizur Rahman, for his rulings and for his wisdom. Thank you to our patron-in-chief, Professor Ishaq, and thank you to all of you who participated in this competition. Brilliant performance by AIMS, brilliant performance by the strikers. Now let's leave it to the umpires and the powers that be to decide who gets through to the end. So from my side, from Wilson's Pharmaceuticals, from me, Dr. Qurban Khan, thank you very much for tuning in. Allah Hafiz.